Hey everybody, Dr. Diane, your Libido Doc here. In this video, we are going to talk about reduced vaginal sensation, the causes, and what to do about it. Now, one of the first things I want to start with is that sometimes having a reduced sensation and numbness is due to a trauma. It's almost like the body can shut down during trauma, as tissue does hold memory. So if you have suffered any sort of trauma or sexual abuse is obviously a type of trauma, but other trauma besides that, if you've suffered some sort of trauma that is something that you have not really had support with healing from, I would definitely recommend strongly that you work one-on-one with somebody who is really trained in how to help you heal from these sorts of events. I have a history of sexual assault myself, so I know firsthand how important it is to work with somebody to heal from this. And the process and the severity is so different every person. So really encourage you to do that. Now, beyond that, other reasons for lower vaginal sensation are things like lower circulation to the vaginal tissue. That's a very common one. Lower nervous system conduction to the vaginal tissue. Sometimes there's pelvic floor dysfunction. The muscles of the pelvic floor may be too loose, or what a lot of people are not talking about yet, it's happening more and more, or too tight. So the muscles are almost too tight, and almost like, imagine like a cramp that's really bad in your, say calf or your Achilles or the sole of your foot, right? Charlie horse types of things. So sometimes that oftentimes would lead to more hypersensation, but sometimes we see when the pelvic floor is dysfunctional, the surrounding tissue around the pelvic floor muscles might be a little bit numb. It's almost like there's so much energy and blood flow directed at certain muscles, right? So if you have a Charlie horse in your foot, you might not have as much sensation in, say, the front part of your ankle, right? Because there are different types of sensations there. So we can see sometimes that some of these reduced sensations can actually be healed by doing pelvic floor work. So really muscular, neurological, circulatory, hormonal, and definitely psychological are some of the top reasons for reduced sensation there. So circulatory nervous system wise, we can do several things. So we can definitely do things like citrulline. We can exercise to help with blood flow. Other herbs such as hawthorn work really well for this. In addition, you really want to also consider that you want to do pelvic floor exercises and working with a pelvic floor therapist to really help those muscles respond appropriately. The other thing I want to mention is the use of vibrators. So I'm going to very shortly in another episode be featuring one of my favorite companies out there, one of my favorite vibrator and sex toy companies. So stay tuned for that. And essentially what this company is doing is this company is actually FDA approved medical devices. Their vibrators are for doing things like reducing pelvic pain, for doing things like bringing more circulation. So one of the things that I'm seeing in women that are using these devices and men is that it can help improve sexual dysfunction. And some of that is reducing numbness, bringing more blood flow, helping with neurological stimulation, even helping with muscular control. So now we're really seeing like, okay, this is pleasure, right? It's definitely pleasure, but it's very cool when pleasure in medicine, we're just seeing how much that's starting to come together more and more. So there is a very big medical point for using devices such as that. So stay tuned. This is a little prequel to another video I will be making very shortly in the near future for you guys. And so definitely watch out for that. And essentially continue to do the things that I'm talking about. I really would recommend doing pelvic floor exercises and not just Kegels, because a lot of times when people are doing Kegels, it's all about the contraction, right? Or J to egg exercises. We want to make sure that we're getting both the contraction as well as the relaxation. And sometimes working with a pelvic floor specialist can really be helpful in the beginning because they can teach you about this and teach you how to find the muscles and teach you how to relax those muscles, because oftentimes we're so disconnected to controlling these muscles in our body because we haven't been trained to do that. All right, everybody. Thank you so much for listening. Please do share this with friends and family if this has been helpful. I'll see you in another video.